Okay, good morning everyone. Welcome today to our event, Reopening of Personal Care and Close Contact Services, focusing on businesses in Rugby and the north of Warwickshire, so Nuneaton and Bedworth, North Warwickshire Borough, so towns of Atherstone, Coleshill, Polesworth, and generally the north of Warwickshire. This is another of our series of webinars aimed at supporting businesses and organisations with information as we follow the government roadmap out of lockdown. The next step comes next week, as I'm sure you all know, commencing 12th of April, when businesses providing close contact personal care will be among those able to reopen. Hence, we're hosting this recorded event today to help with information and answer any questions you may have. We'll start off with an introduction of our panelists. We'll provide a brief update of the COVID-19 picture in Warwickshire, some public health advice on close contact services, some information on risk assessment and what help's available, and we'll talk about local lateral flow testing and contact tracing. The webinar is brought to you today by safety and regulatory colleagues from local borough districts and county councils, Warwickshire Police and Warwickshire Towns team. Many thanks to our partners who have helped us to plan and promote the webinar today. Please note the event's being recorded, so should you remain logged in, we take this as your consent to take part. The information provided today is current and correct to the best of our knowledge on the 6th of April 2021, so please note this if you're viewing the webinar at a later date. So my name is Ian Flynn and I work for Warwickshire County Council, and I'll be your facilitator today. You'll be able to ask questions by raising your hand, or you can post your questions in chat as we move along. So it's my pleasure now to introduce our panelists, and we'll start with Paul.
Good morning everybody, my name's Sergeant Paul Calvert from Warwickshire Police. I work within the COVID cell. And we've been working with regulated partners for the last 12 months regarding COVID. Thank you.
Thanks, Paul. Gemma?
Hi everyone, Gemma Stainthorpe. I work for Public Health Warwickshire and again been focusing on COVID for the last 12 months. Do you want me to do my public health update now, Ian?
We'll do the panelists first, then we'll come back to you if that's all right.
No problem, thank you.
And do we have Aaron?
Good morning everybody, my name's Aaron Coursey and I'm from the Town Centres and Tourism team at Warwickshire County Council, and we work with the district and boroughs quite closely looking at safe reopening and the local town champions, and we also help to coordinate the Warwickshire Towns network, which includes digital training for retailers and hospitality businesses.
Thank you. And Jonathan, are you on the call?
Yes, good morning everybody. Jonathan Toy here. I'm the Group Manager for Trading Standards and Community Safety for Warwickshire County Council, and I've been chairing the twice weekly regulatory meeting of all partners since COVID began now just over a year ago.
Thank you. And Henry.
Morning, Henry Biddington, Environmental Health Officer at Rugby Borough Council. Again, worked with colleagues across the district and boroughs in the county in relation to COVID complaints for 12 months. Yeah, here to help.
Okay, thank you very much. So, could I ask Gemma to give us an update on where we are with the pandemic in Warwickshire?
Sure, no problem, Ian. Am I all right to nick the screen off you there and just?
Please, yeah. I've tried to unshare. I don't know why it's still sharing, but
that's all right. I'll give it a go. Okay, so hopefully I can be sharing a graph with you. Can we all see that?
Yeah.
Lovely, that's brilliant. Okay, so this graph represents our rolling rates per 100,000 population of positive COVID cases within the sort of over the last 7 days. So we can see here we've got the different colours there standing out for different district and boroughs. So obviously, if I just bring my mouse over here, hopefully you can see there a list of the different rates per 100,000 for each district and borough. So Warwickshire is averaging at about 51 per 100,000 at the moment, and as you can see sort of on the graph generally, we've really witnessed a very nice downward trend, which has been lovely to see, which has resulted in this average of 51. I think we can all note here, and obviously this webinar is targeted towards the north of the county, so North Warwickshire has had a little blip here, and is coming in at about 113 per 100,000, which is significantly higher than other district and boroughs. And we are hoping this is a blip, but it's something that we just need to keep our eye on at the moment. And obviously, because this webinar is targeted at North Warwickshire and Nuneaton and Bedworth, which is asking that extra care is given during the next couple of weeks as things start to reopen. But generally, as you can see, the trend has been going quite nicely, and hoping that that is just a blip there for North Warwickshire. So if I stop sharing my screen, which hopefully I can. Okay, there we go. So I can just give you a general update looking at the personal care. So it's personal care or close contact guidance. So thinking about industries such as beauticians, hairdressers and things like that. So I'm just noting some initial, additions to the guidance that are a little bit different from last time. So number one that we've pulled out is ventilation. So as the new variants started to circulate over the winter months, we became aware that ventilation was a really, really good mechanism to stop the spread, or to help reduce the risk of the spread of some of the COVID variants. And this relates really to the aerosol particles, so the really sort of small particles from COVID. And what we're wanting people to do is to really improve ventilation within their settings of work. So there's two mechanisms we can look at. So there is mechanical ventilation using fans and ducts. But again, sort of with that kind of ventilation, really encouraging taking in of fresh air rather than recirculation of old air. And then there is passive flow ventilation, which is basically opening your windows and doors and just letting the air flow through. Either is good, combination of both, great, but just to really kind of ensure that you've got good ventilation moving forward. So that's just my first point. The second point I just wanted to raise awareness of is testing. So across Warwickshire, as businesses reopen, as certain settings reopen, we'll be encouraging really frequent lateral flow tests of members of staff. And just kind of, there's a few ways you can go about this. If you're a larger employer, so if you're employing over 10 people, you can register, and I'm hoping someone will pop a link in the chat, but you can register to order some lateral flow tests to your place of work if you're unable to do testing within the workplace, and your employees can pick them up, and they can be available for employees twice a week. So there is, hopefully if someone pops a link in, you'll see how to do that. And that kind of helps with larger organisations and things like that. If you employ under 10 people, and just generally, if that's not suitable, we would encourage access to our community lateral flow testing sites. And again, I'm hoping someone will pop a link into those, but we've got one per district and borough. And we just would encourage really regular testing. I've seen in the guidance they're recommending twice weekly. Again, please encourage and just raise awareness of that amongst your staff, because we know that 1 in 3 people who are coming down with COVID are still asymptomatic. So it's really, really important to just keep on top of that. And I can see Stella's got a hand up. Do you want me to finish or come to Stella, Ian?
Yeah, if you just want to finish what you're saying, we'll come back to.
We'll be back. Okay, so and then test and trace. Just coming on to that, so you will probably be aware of the NHS generated QR codes that you can download and put in your establishment. Still really encouraging that and use of the app and scanning into establishments. Realising that some people either don't want to do that or don't have a smartphone, so we're still saying please record people's details who've been in your establishment and hold those details for 21 days, please. If another encouragement we're having from our public health consultants is if a positive case has emerged within your premises, whether it be a member of staff or a member of the public, we're asking that with regards to contact tracing, if you could kind of start that process off. For example, if you know that someone's come down with COVID within the workplace who's a member of staff, perhaps start to think about, you know, who have they been in close contact with within the workplace, and ask those people to self-isolate, i.e. don't always rely on NHS test and trace to do that for you. If we can get on top of things quickly, we can shut down the spread really quickly, so that would be hugely beneficial. If you do have a positive case, please notify your local public health team, which will be Warwickshire for us, and I can pop some details in the chat of how to do that, and we can help support you if anything like that happens. So I've rambled on quite a bit, and just thinking if I've missed anything. I can come back to anything that I might have missed, but I'll leave it there for now, Ian.
Okay, thanks, Gemma. Sorry, Stella, did you want to come back with your question?
Oh, you're on mute, Stella.
Just say where you are if you like as well, if you want to say what organisation you're from.
I think I've unmuted.
We can
What
hear you
it is, I've got B5000 barbers in Polesworth, and it was just a question about the flow tests. Can they be picked up from the community place because I have less than 10 workers, or do they have to be done there?
I believe, and anyone can correct me if I'm wrong, but I believe that they need to be done there, unless anyone's shaking their head, which I can't see at the moment. To be fair, it's a very, very quick process, i.e. you go in, you do it, and it's within 30 minutes that the result comes back.
Right.
I will double check that for you though, Stella. If you leave it with me, I'll double check, but I don't think you can take them away.
Right, that's wonderful, because obviously, as you can imagine, when we first reopen back up, our books are full. So to get out to do them tests is going to be the difficult one. Whereas if I can pick them up and get the staff to do them on site, it would be easier as a business for us.
Okay. How many employees do you have? Employees, Stella?
I have 3 employees, 2 which still attend school, so they'll be doing them at school anyway. But the third one does not attend school. Obviously, she's a fully qualified barber as well as myself.
Okay. The only other thing I can think of, Stella, is the opening hours for the LFT sites are they should be quite long, either side of kind of traditional working hours as well, and kind of over weekends and things. So I don't know if that would help, but if we can find some details to pop in the chat for the LFT sites, and I will just double check as well about the takeaway question.
That's great, thank you.
Thanks, Stella. Louisa, did you have your hand up?
Yes, I did. I just wanted to say that I actually went to the lateral flow test in Stratford. I actually booked in last week, and they have got very long opening hours, and like Gemma says, they are open in the evenings and quite early in the morning. And I literally walked in there. They filled in my details. I went and had the test and I walked out again. So, I mean, it really was incredibly quick. And as Gemma said, I got a text message about 40 minutes later saying that I was all clear. And I got an email as well. So it really is, it has been made incredibly easy. So even if you can't get the tests for your staff to do at work, it is incredibly easy for them to do. And I have just posted a link in the chat. I don't know if you can see that. But there is a link there to a list of sites where you can get your lateral flow test. And if you click on there, it brings up all of the sites in Warwickshire.
Thank you, Louisa. That's really helpful, actually. Yeah, so I think, Stella, perhaps I would encourage your member of staff to try and kind of access that in those longer hours. If you're experiencing any problems or if it's not working out, do you want to get back in touch with us and we'll see what we can do? But hopefully those extended access hours will serve you quite well.
Yes, will do. Thank you.
Thanks, Stella. Paul?
Yeah, just on that, I think it was announced last night by the Prime Minister that as of Friday, home testing kits will be available for everybody. And obviously you have to follow that in the news, but and you'll be able to collect them, have them delivered to your address, picked up from pharmacies and from the local testing sites. So there's potential as of Friday that your staff will be able to actually order them to be delivered at home or collected from local pharmacies. But obviously it's a bit of a case of watch this space if that starts on Friday or not. But I know that's what he announced last night, so that might make it easier as well.
Yeah, that's good. That's coming. Thanks, Paul. And Jonathan?
Stella, hi. Nice to see you. One thing I would probably just guide you on at the moment, and you probably know this more than I do, that little blip that Gemma was talking about, obviously Polesworth has had a bit of a part to play in that blip. And obviously I won't go into any details of that. And I'm sure you know about the circumstances. I think, if you've got staff going into school and if you're opening next week and you're in Polesworth, I mean, our view would be we'll do everything we can to make sure your staff are safe. And I'd certainly be talking to Gemma and others in public health about what we can do to help you make sure that you do those tests as regularly as possible for Polesworth and the Polesworth community. So we'll do a little bit more digging if we can help you on that side. But I know if the chief executive for North Warwickshire was on the line right now, he would be saying, give Stella every help that she needs. So we'll go away and see if we can do that for you, Stella.
I should also say there are resources available in terms of posters if businesses want to display information around hands, face, space that are available either to download and print or to collect, and we can post some information at the end of the webinar about where those are available if you want to collect them. Okay, so thank you. So I think, Gemma, you've given us a good overview of the situation in Warwickshire regarding levels and testing and contact tracing. Did we want to say anything, Jonathan, about risk assessment and support for businesses looking at their risk assessment?
I don't want to make it any more onerous because an awful lot of work has been done by people in personal care. I know there has lots of issues in terms of visors and face coverings and screens. Many of the things that you had in place before are really, really important. They haven't changed. If you're doing any close contact work, again, make sure you're wearing a visor and a face covering. A visor is not a replacement for a face covering in your business, and I think you probably all know that very well anyway. Anything you can do on things like pre-booking, again, answers a lot of questions for you. I know many people in personal care have moved to a booking by appointment system. That helps to keep your QR code updated anyway because you've got a record. It also makes it much easier to do contact tracing because obviously we have all the details of the people who may be attending. Most importantly, and I think it's very, very important for next week, is it helps to manage any of the issues in terms of people queuing and waiting in queues. It's a big issue for some of our towns and some of our small towns where actually there's quite a bit of competition for space. So anything you can do to kind of help with that. Gemma's already talked about ventilation, which has been that's been a big challenge for us in terms of the new variants. So any thoughts you can have in terms of increasing ventilation is really important. We'd very much say in your business, any customer who's coming should be wearing a face covering. And again, I know that's very much been part of the process for people in personal care. And to minimise anything which is to do with facial contact. So there's lots of conversations about whether it is right to do facials last year, eyebrows, etc. The closer you are, the bigger the risk. We would probably suggest you probably stage some of your elements of your business, so perhaps things like those more direct facial elements are perhaps a few weeks down the line rather than doing them straight away. I would just get people comfortable. I think the most important thing is to wish all of you the very best in your reopening, to be honest. And if you have any queries, give us a shout. We're here to help. We're absolutely delighted you're reopening, all of you. I can't tell you how many of my team are desperate to get back into the hairdressers or into the barbers or into personal care. It's been the biggest topic of conversation. Forget pubs, forget hospitality. We need our haircut. So we're absolutely chuffed to bits that you're reopening. So anything we can do to help you in any way, just give us a shout. Just continue with the things you were doing before, and that will be the best. That will be the best approach. And to say any challenges, come and talk to us.
Stella, is that a hand?
Hang on.
Oh, you're still on mute. Oh, there you go.
Yeah, just one more other question. One of my staff members, she's asthmatic. Now, I suggested she spoke to the doctor to see if it was possible for her to start her injections. I've had my first injection, and I want to get myself covered totally as quickly as possible. She's in her 40s, and I just feel that one thing they haven't addressed is people like ourselves who are barbers, hairdressers, who can't social distance with our job, making sure that we've had our vaccinations, and whether this is something that can be looked at a bit more thoroughly.
It's not something locally we can hugely influence, but we can certainly feed it through our conversations with different elements of public health. I do know that a number of areas are already offering vaccination spaces for people who are under 50 and have other underlying health conditions, and they are being invited in. Now, a way you could check that is that you could get your colleague to go onto the NHS website, the national NHS website, and if she's got her personal details, or even more importantly, her medical number, she can put that into the system and see whether they are willing to invite her in for a vaccination. So that avoids making direct contact with GPs, which we're trying to encourage people not to do, but you can actually use that national NHS system. And I know a number of people who have done that, and they've been invited in for vaccination. So that might be something to just ask her to have a look at it and see whether or not she does get that invite in. But I know Gemma wants to come in, and she's probably got a lot more detail than I have.
Not really, Jonathan. I was going to support that definitely, to try and enter details online and see if you're eligible that way. One thing I would say, if she is in her 40s and she has got asthma, she should have been called by her GP a while ago. So for that reason, if she can't get through that system, I would encourage a GP call in this case.
Yeah. Okay. Thank you.
Okay. Thanks all. Paul.
Yeah, Stella, first of all, you've got my every sympathy as a police officer. I understand the issues about vaccinations, etc. And with a wife who works in retail through the pandemic, you have my full sympathy. That wasn't why I put my hand up, but just thought I'd state that to you. Just going back to the issue about face coverings, visors, etc., etc. One of the biggest issues that we had when the lockdown reopened last time for personal care was reports to us about premises that weren't wearing the correct PPE, and then the police having to turn up at the doors of hairdressers and things like that, which we don't want to do. It's not great for the image of the business. It's not our use of time. So I just wanted to stress the importance of making sure all your staff wear the correct PPE, because if they don't, no matter where your business is in the county, I will guarantee you that the police, the county council or the local authority will get a call from a member of the public to say this is happening. With regard to staff, and obviously Gemma will go into the details of what's best protection for staff and things like that are medically exempt, please consider looking at the green lanyards for those members of staff so it identifies that they are exempt to the members of the public, because obviously then that prevents unnecessary calls and embarrassment when police turn up and someone says, oh, I'm medically exempt for whatever medical reason. You know, they don't want to divulge that to us. So, you know, if you have got staff like that, and obviously Gemma will advise on whether they should be doing close contact or whether they do other work within the business, but even so, respective, green lanyards are a great source to actually prevent us getting those unnecessary calls for them as well. So I just wanted to sort of make that point. Thank you.
Thanks, Paul. Okay, so if there are no additional questions from those on the call, I thought we'd look now at some of the pre-submitted questions. So we've covered off, I think, face coverings, both for staff and customers. There is a question around, can businesses accept walk-ins, or do they need to pre-book their customers?
I don't think we can discourage a business from allowing walk-ins if that's how they feel that they can operate. Our view remains that pre-booking is a much safer way to manage during this time. And I don't know, I've spoken to a number of my friends who are in this industry, and in some ways it's helped them. Actually, it's helped them kind of plan a lot of their work and actually deals with some of the backlog. I think we have to be flexible as districts and boroughs and regulators on a whole in terms of opening hours for some sectors of personal care. I know that might be something that comes in that people want to work a little bit longer. And I know a number of hairdressers and barbers have actually done that just to ensure that customers have a bit more flexibility on access. So I'd be encouraging personal bookings, but I do know businesses who have allowed walk-ins to go in. I'm not sure customers have felt overly safe on walk-ins, so please bear that in mind. That is something that has definitely come back to us, that where we've had complaints, often it's people who said, I went to the barbers and a walk-in, there were loads of people sitting and waiting, and I actually left, and that became a complaint about the business. So my view is look at it from that perspective, not necessarily in terms of whether it should or shouldn't be allowed and what works best for you. I mean, many of you will know your own customers anyway, and a number of you, I'm sure, will have quite elderly customers. And I'm sure they would much sooner have a pre-booked appointment where they're feeling coming into a safe environment. So that would be my advice.
Okay, thanks, Jonathan. Henry?
Thank you. Yeah, I'll just reiterate really what Jonathan said. I think from a district and borough point of view, we'd be fully advising premises to do a pre-booking service. Now, I appreciate that doesn't necessarily work, but as Jonathan says, the main thing if you're not going to do a pre-booking service is how you manage people coming in and out of your premises and making sure you've got enough space for people to come in. And I particularly think this may be an issue so that first couple of weeks when people are desperate, as Jonathan says, to get their haircut because they haven't had a decent haircut for quite a long time. So, you know, it's important that you manage the space within the premises for people waiting, because you might get lots of customers all turn up at once wanting to get their haircut, and manage your space outside of your premises as well. Because people are queuing up to use your premises, you have a partial responsibility for making sure those people queue up in a sensible and orderly manner and don't start blocking roads and pavements and things like that. So I think it's something as part of your pre-planning to reopening, if you're not going to have a pre-booking system, that you really need to think about and really need to put in place measures to ensure that if you do have 30 people turn up into your shop and you've only got space for 5 of them, what you're going to do and what your policy is going to be to ensure that those customers are socially distanced within the premises and outside the premises, and maybe come up with some ideas of doing appointment times so they could come back and at a certain time to get their hair cut rather than hanging around within the premises or outside the premises. I think that's going to be really important, particularly for the first few weeks when people are desperate to come back and get their hair cut.
Okay. Thanks, Henry. If there's no further questions or comments on that, we'll look now at a question we've had in by email. I'll read it out. Do you know, are we allowed to get the team into the salon before the 12th of April for a day of team training to get them ready for work. We were allowed to do this after the first lockdown last year, but I can't see any notes on that for this latest opening. So any thoughts? Can the personal care sector, can they bring their staff in before the 12th for training?
I'm happy to jump in really quickly and say absolutely yes. In fact, it's a great idea. Why not? I think it's also, but please bear in mind how your staff are as well about coming in, that they might have their own concerns. So anything you can do that can help and support them, great. We are offering a service, a wellbeing service to all small businesses. So Susie, Stella on the line today, if you would like access to a mental wellbeing service free of charge, we have a facility set up and available to us, and I'm sure Louise will put a link to chat. All you need to do is sign up for the business, and your staff has access to mental health wellbeing, counselling support, and access to a hotline without any cost to you as a business. And I'd absolutely encourage you to get people in. Re-familiarise themselves with the layout and what your expectations are. It's a great idea. Just avoid making them coffee. That's all I would say. Okay, get them to bring their own. But yes, definitely do it.
Just to add to what Jonathan said, there was a business pledge launched a couple of weeks ago, the Coventry, Solihull, Warwickshire COVID Business Pledge. And that is an opportunity for businesses to show that they're signed up and are following best practice around COVID secure. So it covers committing to distancing for staff and customers where possible, ventilation, best practice, commitment to encouraging staff to test and to isolate. And it also automatically enrolls the business in the service and support that Jonathan's just mentioned, the EAP, employee support. So if you look out for that over the next week, there'll be a further press release, and then there'll be a link on our webpage for you to access the poster, which you can put up in your business window or in your staff canteen. Just to show that you're following best practice. Aaron, sorry, your hand's up.
I was just going to support Jonathan's comments there about the training and while the staff are in there, the ability to be able to explain how queuing will happen, what you're telling your customers, and that positivity around coming back into the salon or to the barbers, and being able to explain what the processes are, so all the staff are aware that people might have to wait outside if the next person isn't ready, etc., and all of that. And absolutely, it's a great idea to be able to do that, and then everyone's singing off the same hymn sheet, and everyone's telling their friends that they're open as well, and that sort of positivity that we're open in a safe way and that the customers are going to feel safe will really sort of help those first 2-3 weeks where we are all desperate for personal care to open.
Thanks, Aaron. Okay, so shall we move on? I think we've touched on this already, but in terms of businesses recording personal details for tracing, and if they still need to collect that information, how long do they need to hold on to it for?
Yeah, so just to reiterate that is still 21 days, please, just to allow for accurate contact tracing. And just to re-emphasise, please, everyone knows what a close contact is now, and kind of identify that within their business. So if you think that something has happened, exposure has happened, please tell people to self-isolate and get in touch with us, and you can help kind of get on top of that process quite quickly.
Okay, thank you. And another question here around how often do I need to clean equipment that's used in the salon? This is obviously, well, I'm sure this will be the same as it was last year, but is there anything additional around that?
So I think following the link that is in the chat, there is some sort of detailed advice around cleaning, but just to kind of think about, you know, any pieces of equipment that are used on a person need to be disinfected in between use, you know, and doing that quite thoroughly, really. So with regards to things like that, I think that you know what those are, and they need to kind of be disinfected straight away. I think thinking about the wider environment, things like touch points, you know, we said this last time with regards to your door handles, you know, perhaps the till, the phone, things like that need to be disinfected on a really regular basis, you know, every day, a few times a day. You know, just kind of it's whether you just write out a routine, you know, of when that's going to happen within your working day. And there'll be lots of ways that you can tailor that for your business, but it just need to be really, really frequent. And yeah, and it's, you know, it's general usual disinfection products are fine generally to be used. And then if an outbreak occurs or a positive case has been in your business, we can help advise with extra cleaning and extra, you know, a specific kind of product that would need to be used in that case. So you can always ask us for help.
Okay, and what's the best route to access that help, Gemma?
I will put the email address in the chat, but it's to email our single point of contact for Warwickshire, which is dphadmin@warwickshire.gov.uk, and I'll put that in the chat for you.
Yeah, so that will be in the chat, and also when we post the recording of this webinar on our YouTube channel, it will have again a full list of useful links that we've discussed today, including that one.
Ian, could I just share a couple of other points? It may not be relevant to people on the call today, but I thought just a few things of where we've seen outbreaks occur in the last couple of months while other premises are being closed. So you may not surprise people where that actually anything which has got a shared facility has been a source of spread. So a shared kitchen area. I know I was joking earlier about people weren't using mugs or making coffee for each other or tea for each other. That actually has been a route of spread. And we've seen that in a number of premises that remained open. We've had you know, quite a large percentage of the workforce affected by that. So people using their own mugs, their own spoons, their own cutlery, not making drinks for other people. As selfish as that might sound, it's a much safer way. You know, having clear understanding of who's allowed in the kitchen area at certain times, shared toilets, things like that, regularly cleaned, they become really important. Lots of challenges for us around shared car journeys, so colleagues helping people out and giving people a lift to work, because you know, they live in the same area and it's easier. Shared car journeys have been an absolute source of spread. Of probably all the things, we've seen that as an absolute common feature in some of our businesses. And sometimes it's quite difficult, because if your place of work is a bit distant and people are travelling from the same area, they think it's okay. But if you're a different household, it can be quite an issue for us. So I would highlight that very much. So they're the things we've seen quite regularly, rather than it be the daily things. They're the common features that we're seeing with the recent outbreaks.
And actually, Jonathan, that links nicely to another question that we've had around customers using cash. I guess we can't say don't use cash, but what's the kind of messaging around cash versus other forms of payment?
I think you've already said it quite nicely. I mean, you know, we can't force people not to pay with cash, in the same way as if, you know, any of us go out shopping in certain areas, you have to use cash. If I go down to the market stall, they'll do nothing but take cash. So we can't stop people using cash. If you can do anything on a prepayment service, then great. and I'm sure everyone on the call or listening to this will have a way of taking cashless payments as well. So either of those would be a much better solution than using cash. Yeah.
And I would say actually my local market trader, fruit and veg, he has adapted and he does now take card payments. So there's a lot of change coming on the high street.
Well, I tried that one with mine, Ian, and I won't tell you the words he used to me, but they weren't polite and certainly not repeatable on a webinar. But he definitely told me where I could place my card and could I pay with cash.
Okay, interesting. Gemma.
Yeah, just a tip on that front. With regards to kind of, yeah, please encourage cashless payments, but if it's not possible, it's not possible. But just thinking about minimising the risk if people are paying with cash. So just kind of really think about hand sanitisation after handling cash. And again, just hand sanitisation generally, that brings me on to, you know, encourage hand sanitisation when people are coming into your premises, when people are leaving your premises, you know, staff in between clients. And just regularly kind of having those hand washing facilities available, warm water, soap, and sanitizer as well. But especially thinking about if cash is used, you know, you've still got that control in your hands, if you like, of kind of keeping on top of hygiene.
Okay, thank you. Paul?
Yeah, it's probably just to top up what Jonathan said really about outbreaks and things like that. I just thought it worth mentioning some of the main calls that we get as police about business premises and around sort of like the close contact businesses as such, the sorts of calls that we get and how to prevent those sort of calls coming into us as such. I've already mentioned the one about face coverings with staff and customers. The other things that we routinely get called about when people walk past premises are staff huddling together closely in premises when they're not busy, not social distancing and things like that. We quite often get calls about that. Customers not social distancing, so if your premises is busy and your seats aren't spread apart where people are waiting and things like that, we all get calls about that. Track and trace, surprisingly enough, if businesses aren't doing track and trace or on site, we'll get calls about that. We also get called, believe it or not, about premises that don't offer hand sanitizers on entrance and things. You know, people will call us for many things. And another one that we have had before, just to make you aware, so you are really strict with your staff and keeping up to date, going back to the self-testing and things like that, is people not self-isolating when they should be. You know, if any of your staff or yourselves or whatever are a close contact, it becomes public knowledge quite quickly within the community, especially if you're a community business as such. And people will call the police if they believe staff are not self-isolating when they should be. So, you know, you need to be really strict with your staff. If they're doing LFTs, then ask them when they're doing it what the result was, and then do your contact tracing early, because, you know, it needs to be done for public safety, but also you don't want us knocking at your door again for things like that. But those are sort of the top few things that we get called to that would be, you know, pertinent to your businesses as well. Okay,
thanks, Paul. So I don't see any further questions in chat. I think we've covered off the main questions.
I'd just like to come in and add, Ian, if I can, that obviously I know we've gone on about precautions and everything and how to keep everyone safe. But as Jonathan said, you know, we really wish you well for your reopening. It is an exciting time that we've all been waiting for as we move along this roadmap. You know, we're all delighted to take those steps along it, and we're here to help you stay safe. So just, yeah, wishing you all the best of luck with it, really, and we're here to support you if you need us.
Okay.
Can I just add a bit to that, if that's all right? I hope Henry and Paul and Gemma agree with this, because we've been on this journey for quite some time now. I would say our position slightly shifted with this reopening, because we really genuinely want this to be the last time we ever have to go into a lockdown in the way that we have. So I think our role is very much about how do we make sure that we work with good businesses to keep the sector open. That I think is our stance now, and I don't really want us to be focusing on those, you know, who are in terms of enforcing the regulations. It's more about making sure that we're all doing the right thing to keep the sector reopen. And anything you can do to work with us to help that. Now, whether that's through the pledge or whether that's through things you're doing well or Facebook or stuff that you can pick up and feed into us, do it. And I think, you know, that's our commitment now. You know, we all feel that this has to be kind of the last time. And if we don't work together on it now to really achieve that and make sure that we can keep businesses, small independent businesses like those in personal care open and functioning, we're not doing the best we can. So I think that's our message to all of you now, and please join us with that. And as I say, speak to us, feed stuff into us, or ask us any questions that help you and enable you to operate safely.
Thanks, Jonathan. I've just posted a link there to the pledge. Susie, I see you've posted a question. Would you like to put the question to the panel?
Yeah, I was just wondering, are we still recommending temperature checks?
I'll start on that one. So with regards to temperature checks, it's always been a really difficult one from a public health point of view, because even if you take someone's temperature and it's showing as normal, it doesn't necessarily mean that that person isn't, you know, with carrying COVID. They might be asymptomatic. It might be at a different stage of the point of infection within that individual. So to rely on a temperature check, I would never encourage to do that. Within the guidance, it's encouraging some simple screening questions of your customers. So just the general, you know, should you be self-isolating? Have you got any of these symptoms? You know, continuous cough, yes, temperature, and then loss or taste of taste and smell, or change of taste and smell. So that would probably be more important. And again, obviously, if you take someone's temperature and it's normal, as I've mentioned, it doesn't necessarily mean that it's safe, and then it can sometimes create a false sense of security, and distancing might minimise and things like that. So it wouldn't really be my preferred mechanism of monitoring things.
Okay.
Hope that helps.
Yep, perfect. I had no temperature at all when I had COVID.
Exactly. There you go.
Yeah.
Thank you.
Thanks, Susie. Stella, see your hand?
Yes, just wanted to add how we're doing our system when people arrive at the barbers. We've got a doorbell on the front door. We keep the back door open all the time to allow the flow of air coming into the shop. We have a doorbell on the front door. There's a sign on the door that says, please press the doorbell and wait to be greeted. What happens then is they are greeted. We check through the questions to make sure they should be at the premises and that they shouldn't be at home isolating. We then show them to an area that's been cleaned, ready for them to sit down. So I actually advertise all this on my page, so that customers can feel at ease knowing that when they come to the business, all areas have been fully cleaned before they arrive.
Yeah, it's
brilliant,
excellent.
Stella. Yeah, I just wanted to say, you know, really good processes you've got in place there, and I think encouraging, you know, spreading the word amongst your clients, you know, and amongst other local businesses to show, you know, the steps that you're going to keep people safe is really positive.
Yeah, and it must be great for many customers to know what to expect before they get there. Yeah, that's great. That's good.
Okay.
Thanks, Stella. Any further closing comments of Paul?
Yeah, just firstly, I just want to reiterate what Jonathan says. You know, obviously the local council, environmental health office, public health, and Jonathan's team are more adapted to being able to give the risk assessment COVID advice as such. But from a general collective, you know, we all want to work together with all businesses that are reopening to make sure this is the last time we go through this, and supporting you. And, you know, everybody has suffered throughout of this, and, you know, we don't want to go back to where we were. So we want to support you as much as we possibly can. So please do contact your local authorities, public health, whatever, if you have those questions. I'm sure there'll be some emails put into the chat and at the end by Ian for that. But I just wanted to wish you success with that. My wife will be extremely happy that she's no longer got the clippers out to cut my hair anymore, because that causes many arguments. But I just, let's hope it does do it safely. And businesses' reputations are very much during COVID are down to how safe they are. And the safer the business, the more customers you will get. And we've seen that throughout, the reports that we get, I'm never going there again because of this or that sort of thing. So the safer you are, the better your business will be in the long run for you. So I just want to wish you all good luck and to stay safe.
Thanks, Paul. Yes, so Gemma's already posted, and we'll put it up at the end as well, the links to public health, the email address for public health. But if you're not sure who you want to contact, if you send an email to business@warwickshire.gov.uk, we can pass that on to the right people. It's business@warwickshire.gov.uk. So this webinar this morning was focused on the personal care sector in Rugby, Nuneaton and Bedworth and North Warwickshire areas, but we'll be hosting a second one tomorrow at 1 o'clock, focused on the south of Warwickshire, but anyone's welcome to join. And if you know someone who's missed this today, they're very welcome to join tomorrow. We'll also be posting a recording of this on our Warwickshire County Council YouTube channel, and that should be live the day after tomorrow. So we'll share that link out, and do please share that with colleagues and friends if you think they'd find that useful. So if there's no further questions or comments, I'd just like to thank all our visitors today for joining, and also to our panelists for their time and preparation. And as others have said, we wish you all in the personal care sector, and indeed other businesses reopening, non-essential retail next week. We do have further webinars covering other sectors. I'd invite you to check those out if they're of interest, around the hospitality sector, with outdoor facilities, and the non-essential retail sector. So all the best to you with your business, and hope to see you on the high street soon.
Thank you.
So everybody,
Thanks
all the
all.
best.